In this short video, I'm going to give you my top 3 reasons why, as a pregnancy and postnatal specialist strength coach with over a decade's experience working with this population, I personally don't program and don't recommend full range barbell back squats during pregnancy. So if you're currently training during pregnancy and continuing to barbell back squat through full range of motion, or you just want to ensure that you're training in the safest possible way during pregnancy, then this video is absolutely for you. Now, I get it. When it comes to training, I understand people get pretty attached to their training styles or methodologies. And for those of us who are used to squatting a certain way, when you already feel like you're giving up so much of your body and ways of doing things to another being, maybe giving up something that you do purely for yourself and possibly even for your mental health can almost feel like a step too far. You may even be struggling with body image, and it's that seeing that scale going up so consistently every week is really freaking you out. So the thought of changing your training is just too much for you. It may be that you're worried that if you adjust your usual training style too much to accommodate your growing baby, you'll never be able to return to training this way once the baby's been born, or the journey back seems too far. And I understand pregnancy is a time of all-encompassing change. So all of these reasons I genuinely understand. But if there is a small part of you that feels like you need to prove that pregnancy isn't going to stop you doing the things that you love in terms of training, I think now would be a really good time to remind you that you are doing the most metabolically challenging thing a body can do, bar none. And that's growing another human. Just think about that for 1 second. Every single one of those trillion cells that make up your baby, you are creating. By just doing this alone, you are already Wonder Woman. You don't have to prove anything when it comes to your training. I don't know, maybe it's me being conservative because I've worked with so many women over the years who've suffered from debilitating abdominal separation, pelvic floor dysfunction, prolapse, and even levator avulsions. Now, obviously, these women came to me postnatally and were coached by me during pregnancy, but maybe it's because I know the statistics around 1 in 3 women having some sort of degree of prolapse post-birth, and that 100% of women have abdominal separation in late stage pregnancy, that in my eyes, I want to protect their bodies the best I possibly can, and believe the number one thing your training should be centered around during pregnancy is your overall health and well-being to support yourself and your baby during pregnancy, the birth, and your journey as a new mum after. And part of that is ensuring that you are training in the safest possible way and protecting your body. Because the thing is, pregnancy causes all kinds of wild things to happen to your body. And I genuinely believe barbell back squatting to full range under relative heavy loads, and that's relative to your own lifting capacity, of course, can exacerbate these things further. So with all that said, let's look at my top 3 reasons why I personally don't program and don't recommend back squatting to full range during pregnancy. And they are the changes to your posture, intra-abdominal pressure, protecting your abdominals and your pelvic floor. Okay, well maybe that's 4. But if you ask any of my clients, they'll 100% tell you that I can't count. But when it comes to your posture during pregnancy, we already know that the weight of the baby changes your center of gravity. Now, to counterbalance this, your pelvis anteriorly tilts forwards, right? Now this places more pressure on your hip flexors, quads, adductors, and abductors. And another common side effect of anterior pelvic tilt are your glutes weakening. But when it comes to the anterior pelvic tilt and back squatting to full range, what this might mean is when you're already starting quite anteriorly tilted, you might actually run out of hip flexion room sooner than you normally would or when you weren't pregnant. But the result of this kind of running out of room would mean that your lumbar spine is going to compensate by going into lumbar flexion, or what's commonly known as a butt wink, which isn't great as it places you at an increased risk of disc injuries. And remembering during pregnancy, your spine is already more mobile due to the hormone relaxin and your abdominals stretching. Now, your posture and changes in alignment also play into your breathing and the coordination of muscles involved. Remembering your diaphragm is at the top of your core, the bottom of your core is your pelvic floor. And of course, all of these things work synergistically. So when it comes to intra-abdominal pressure and your pelvic floor, we already know squatting has the highest increase of intra-abdominal pressure of any lift, and that's second only to wearing a belt while squatting, but I've already done a video on that. So you need to consider the stretch on the pelvic floor as you go down into a full range squat. So at the bottom of your squat, your pelvic floor is going to be in quite a stretched position. Then of course you have the force bearing down on it in this stretched position is again quite high. Then you're pretty much using what's called the stretch reflex to bounce out of the bottom of your squat, which then places added pressure on your pelvic floor as well. And remember, your pelvic floor is already under increased load due to the weight of the baby. And because it's a muscle, and like all muscles, it's prone to fatigue as well. So there's a lot going on here that needs to be taken into consideration when it comes to your pelvic floor and barbell back squatting. And without all of the other reasons, just the load on the pelvic floor, in my eyes, is enough to not program full range barbell back squats during pregnancy. But you can't talk intra-abdominal pressure and pelvic floor without mentioning abdominal separation, because when you consider how your posture affects your breathing and muscle coordination, and then of course we have the increased intra-abdominal pressure. Now, I've done a whole video on intra-abdominal pressure and its effect on the pelvic floor and abdominals, so I'm not going to go into it in huge depth here, but for the sake of this video, it's very important to know that any incorrectly contained intra-abdominal pressure is going to blow out through your weakest link. And when it comes to intra-abdominal pressure and abdominal separation, considering 100% of women have abdominal separation at late stage pregnancy, but in my experience, it happens much earlier. I mean, I've had women come to me at 12 weeks pregnant with their first baby who already have abdominal separation. So any incorrectly contained intra-abdominal pressure is going to be pushing out through the weakness in the abdominal wall, potentially increasing your abdominal separation. Now, this is always something that I try to avoid or minimize during training when pregnant. So it's for all of these reasons why I prefer the box squat, along with a lot of soft tissue work for the hips during pregnancy. But I'm going to leave the reasons why I love the box squat for another video. Of course, if you'd like more in-depth pregnancy-specific content, feel free to apply to my complimentary but private community, the Preggy Training Crew. The link is in my bio.